In this lesson, we're going to talk about the viscerocranium, or the face. The viscerocranium consists of 14 bones that make up the facial skeleton. These bones give us our appearance. The nasal bones are the first two to look at. They form the bridge of the nose. That's where your glasses would sit on your nose. The lacrimal bones, there are two of those. They form the medial orbit. The orbit again is the eye socket. Medial means the middle part of the eye socket, or the middle wall, the most towards the midline. They're the smallest and most fragile bone. They resemble a fingernail in the thickness, and part of the tear duct passes through the lacrimal bone near the inner eye. The vomer bone, there's one of them, forms the posterior portion of the nasal septum. The nasal septum divides the two nasal chambers, and the vomer is located in the nasal cavity. Here's your nasal bone. There's two of them, a right side and a left side, and they're right at the bridge, what we call maybe the bridge of the nose. The lacrimal bones are tiny little bones found inside the eye socket area, the orbit area. There's one on each side, so there's a left and a right. And the vomer is right here. Here's the nasal area, nasal cavities. Here's the septum that divides those nasal cavities into a right and a left. And here's the vomer bone. There's only one of those. The zygomatic there are two of those. They're the cheekbones, right and left. The maxilla, there are two bones. That's the upper jaw. That maxilla forms the anterior section of the palate, the floors and orbits of the floors of the orbit, and the floor and sides of the nasal cavity. It's the largest bone in the face, and it really is made up of the two bones. They join together to make one bone, one unit, but it's two bones, and it's joined by the median suture. It consists of a body and four processes. The zygomatic process joins with the zygomatic bone to form the cheekbone. The palatine process forms the major portion of the hard palate. The frontal process extends upward and backward along the side of the nose, and the alveolar process surrounds and supports the maxillary teeth. It includes the sockets for the maxillary teeth. Here's the zygomatic bones, these sort of pinkish colored ones. There's a right side and a left side. Here's the maxilla bone all across here, and this is the zygomatic process right here. Alveolar process, the frontal process here, and here's the median suture right in this area. Some landmarks on the maxilla. One is the canine eminence, an elevation of bone over the canine root. There's a right side and a left side, and it's usually viewed as it's the maxillary canines, teeth number 6 and number 11. The infraorbital foramen. The infraorbital nerve exits onto the face here, and that's one of the nerves that's used to anesthetize the patient when we're doing dental work. Maxillary sinus, the largest of the paranasal sinuses, is located within the maxilla, above the roots of the maxillary posterior teeth. Pain here feels like a toothache in the maxillary molars. And the maxillary tuberosity, it's a bulging area of bone posterior to the maxillary third molars, teeth number 1 and 16. So here's the, again, some of these areas that landmarks. Here's the infraorbital foramen. There's one on either side, left and right side. Now again, this is two bones that are fused together right here by the median suture. Here's the maxillary sinuses down sort of on the behind this area here on this side. Here is the canine eminence. In this particular little picture, it's called the cuspid eminence because that's another word for canine, but it is the canine eminence. This is the alveolar process where the teeth are located. And this is the tuberosity, which is another part of the bone. You can't really see it in these views, but on the side view you can see it. The bones of the visceral cranium continue looking at the inferior nasal concha. There are two of them, and they lie in the nasal cavity and join the maxilla. The palatine bones, there are two of those, and they form the posterior section of the palate. There are two foramina on these palatine bones. The greater palatine foramen, which has a large opening for the greater palatine nerve and artery, and the lesser palatine foramen, which are located posterior to the greater palatine foramen, and they transmit the lesser palatine nerve and artery. These openings are where the nerves and the blood vessels pass in and out, sort of weave around the face to bring blood supply and nerve or sensation to the face. The doctor utilizes those those openings to inject the patient for anesthesia. Here's the inferior nasal concha. They are right here, so nasal always has to do with the nose. So it's here, and it's these little areas right here. In years past, when they were first defining and describing bones, they thought of these as conch, looking somewhat like conch shells. So you've got the concha. There's actually a superior one that's further back that you can't see. So these larger ones that you can see are the inferior nasal concha. The palatine bone is right here. So this is part of the area. The soft palate is back in this area. The mandible, there's one of those, and it consists of one body and two rami, or a ramus, or two rami. It has a horizontal body and a left and right vertical rami. They consist of the following. The ramus, each ramus contains a condyle, which is a rounded knob that joins with the mandibular glenoid fossa, a coronoid process, which is a pointed flat projection onto which the temporalis muscle inserts, and the sphygmoid or mandibular notch, the curved notch between the condyle and coronoid process. The mandible is the only movable bone in the face. Our next lesson will give more information, more specific information about the mandible. Here's the mandible itself. This whole area here. This is the body of the mandible right here. And then the area that goes up vertically is the ramus. There's a right side and a left side ramus.